Good afternoon. Welcome to This and That. It's Monday. And if you're a regular viewer of our program, you know that this is usually the day when Bob Johnson joins us for his one-on-one interviews with local politicians, musicians, or other people of interest in our community. Well, it seems that Bob has been the person of interest lately, since many of you have noticed that he's not been at the news desk in the last couple of weeks. Bob has been the face and voice of news in the Tennessee Valley for more than 30 years. And in that 30 years, he's done literally hundreds, if not thousands, of interviews. Today, we reverse the roles. Here's a very personal one-on-one with Bob Johnson. After several weeks of testing, doctors have officially diagnosed Parkinson's, correct?
Yeah, it took a long time to determine exactly what was going on. In fact, it goes back about 2 years almost when I started feeling stiffness in my body. 2 years? Which I attributed to old age, of course.
Naturally.
Getting creaky and cranky old age. But there was a stiffness and a difference in the walk and so forth, and I knew something wasn't right, and I didn't know what that stiffness derived from. More stiffness than shakiness, which is classic.
Because Michael J. Fox, he very pronounced shaking with his...
classic Parkinson.
Yeah.
So I started under neurological care then and had some tests run then, and it was diagnosed that I had Parkinson's, early stage Parkinson's, which came as a shock to me, of course, as it would anybody. And I said, well, what do I do? And they said, well, there's medication that can stall it, halt it in its tracks, so to speak, or stabilize it at least. Mm-hmm. And you can go on about your life. But it is debilitating to the extent that it detracts from your agility. It makes you stiff. To compound the problem, I've had a chronic back disorder for some years, degenerative disc, that caused me stiffness and lack of movement and some pain and so forth and so on. So I decided to check it out. And in the past few weeks, I've been checking it out, and under the care of a neurologist once again, has confirmed the Parkinson's, not classic Parkinson's, but Parkinson's nonetheless. And we're testing my body, so to speak, to see what I can do and what I can't do. And I understand there's been quite a lot of inquiry from the public, and I appreciate your support out there and all your prayers and your calls and your inquiries, and I'm sorry I couldn't give you an answer because I didn't have an answer at the time.
And we here at the station couldn't either, because talking to you, you didn't know, we had to wait, and the physicians have taken what I think is the appropriate amount of time to make sure that they knew what your diagnosis was, because, I can think there'd be nothing worse than saying you had so-and-so and you didn't.
Yeah, because that could lead you astray in your medication and your treatment.
Sure.
Trying to determine a treatment plan depends upon a solid, sure diagnosis. And so,
did your physicians tell you what they meant by not classic Parkinson's symptoms?
Well, I guess the tremors in the body are classic Parkinson's. I'm not fully versed on what's classic Parkinson's and what isn't. But it affects the body's ability to produce dopamine, which gives you agility and fluid movement and so forth, as it affects the movement of your body. So what they do is they give you a synthetic dopamine, in a manner of speaking, to treat the Parkinson's, which levels out your body muscular and agility and movement and so forth and so on. What was happening on the air was, and what people were remarking about was, I looked like I was stiff. And I hated that detriment, that distraction in my air performance, but it wasn't anything I could do about it. And under a doctor's care, I'm trying to retain that agility and normal movement, so to speak.
And to compound that, as you said, your back was bothering you, and whether you realized it or not, it was causing you to sit like this a lot of times.
Yeah, there was a weakness more in the right side for whatever reason, and I had years ago, had a mini stroke right here in the back part of my neck that caused an occipital problem with a neurological problem with the upper left vision. This side of your brain covers this side of your vision. Mm-hmm. So I didn't know what there might have been some problem with a minor stroke, and the weakness in the right side of the body made me wonder that even more. So in the past few weeks, that has been checked and tested. It turns out there's been no activity since that happened several years ago. But there are some issues we're looking into about my whole body. I decided it was good to check everything.
As long as you're in for your 100,000-mile tune-up, check it all.
Yeah, check the differential and the wheels and the axles and so forth and so on, because I want to make sure that everything's clicking all right.
How do you feel?
Well, it's like good days and bad days, Don. You wake up in the morning and you feel a little stiff and you wonder, is it getting worse? And you take your medicine and it levels out. And you have to take your medicine on a prescribed schedule every several hours and keep it at that same level throughout the course of a day, and it usually levels it out pretty well. But there is some weakness that comes from it, and lack of movement and walking is, well, a little more difficult. Things of that nature. I'm finding out more and more about it as I go along. But it's something you live with and you try to control and stabilize as best you can. Unfortunately, I haven't been at work and everybody's been missing me, and I appreciate that support.
Yeah, we've had literally, I think, thousands of inquiries, telephone, email, stop you on the street and ask. People are concerned because you've been in the living room for 30 plus years.
Going on 32 years in July. And maybe in the future I can do that again. I don't know that at this point. I'm still going through testing and finding out the potential for future growth and future determination that I will find out what I can do in the future. But the doctors have to tell me that. So that's why I've been out and taking medical leave, and hopefully things will level out and something can happen in the future. I don't know at this point.
Yeah. So you don't know whether you continue here or not. It's just unknown at this point in time.
Well, I would hope that would be possible, but the number one priority right now is my health and getting that stabilized. And though I appreciate those who say we want you back, I want to come back when I can come back. And if I can come back.
This and That wants you to have the best seats in the house and enjoy the Harlem Globetrotters as if you were sitting in your own living room. And you'll have the best seats in the house courtesy of Bennett's, and all that you have to do is watch the fun and frivolity. To enter, send a self-addressed stamped envelope to This and That, Box 60028, Chattanooga, Tennessee 37406, or stop by and enter at Bennett's, located at 2880 Amnicola Highway. Watch This and That. Get the best seats in the house and see the Harlem Globetrotters March 20th at 7 o'clock at the McKenzie Arena.
Where to for lunch, boys? I want to get me some Captain D's.
Indulge your cravings with more choices during Captain D's Seafood Celebration. Try our new lobster and shrimp platter, or our new lobster and shrimp pasta Alfredo, or new torpedo snack attackers. You've got more choices during Captain D's Seafood Celebration.
I recently met with someone who's thinking about taking early retirement. I think she's been disabled and could have been drawing her disability benefits for the last few years.
Social Security awards disability benefits to many workers over age 50 if you can no longer do the kind of lifting or standing you used to do.
Of course, it also depends on your work experience and education. It sounds complicated.
But it doesn't have to be. Call us and let us help you present your disability case.
The law firm of McCarthy and Murphy, attorneys delivering the personal attention you deserve.
A trip to Pearl Vision may have ended up saving my sight.
I gave Diane an exam that included our new Optimap system. It allows me to see more of the retina at once than ever before, so it's easier for me to diagnose a wide range of eye conditions.
I had a small tear in my retina.
Fortunately, we caught it early.
It's a simple exam, but it's an important one.
They're Diane's eyes, but they're my responsibility.
To schedule this important exam, call 1-800-YES-EYES. Nobody cares for eyes more than Pearl.
Certainly want to thank Bob for being so candid with us and tell us what's been going on, or what he knows is what's going on right now. We certainly do appreciate that. Well, naturally, I wanted to learn, and I think all of us here on staff wanted to learn more about Parkinson's disease. So we talked to Dr. Paul Hoffmann. He is the medical director at Siskin Hospital. Does one day things just start happening, or is it over a period of years?
It's usually a gradual process that happens, and when we talk with folks that come into us and we have a diagnosis of Parkinson's, usually when we go back and take a thorough history, we can find certain things that they in a group talk about that they experience. These things are typically stiffness or rigidity, difficulty getting around. A lot of times people report difficulty getting out of bed, difficulty rolling around in bed, getting up from a chair. Depression can often be a sign of Parkinson's disease. Those are a lot of the initial presenting signs that we see, this difficulty with mobility and getting around, also with balance, that the patients report that they have more trouble standing, that when they walk they're more prone to fall. These are all things that can be signs of Parkinson's. If a person thinks that they have Parkinson's disease, the first thing to do is to seek treatment with their family doctor or internist that they see. And then typically a referral to a neurologist is made who is the specialist in diagnosing this disease. It usually is diagnosed with scans that are done, MRI scan of the brain is usually done, and then the clinical symptoms and presenting symptoms that the patient has, and then the neurologist is able to put that together.
What about the medications for treatment? They're varied, aren't they?
They are varied, and there are very many of them. Again, if it's a very early case of Parkinson's, a lot of times the family physicians are very good at taking care of that, but in a more complex case of Parkinson's, really a neurologist should be involved in the medication choices for that patient.
Does it run in families?
The genetics of Parkinson's are still highly debated right now. There is some probable familial trait with it, but we're still not sure.
Patients getting younger as far as, or is it after 60 or whatever, or some people 40 and 50?
We all know Michael J. Fox, who's a very well-known patient with Parkinson's disease. So it can affect, certain variants of Parkinson's can affect people at a very young age. And then there are different variants that affect people as they get older. So there's no rules for Parkinson's that it has to affect you at a certain age.
If it starts with one variant, does it continue that way, or does it change as the years go on?
Well, it usually changes and probably gets a little bit worse as time goes on. And different people have different symptoms within Parkinson's. Some will have severe tremor that we see with the pill-rolling tremor. Some never develop tremor. Some develop just the rigidity and stiffness of Parkinson's disease, the difficulty getting around, the balance problems that come from it. So there, again, it's no hard and fast rule that every patient has to have this symptom to have Parkinson's disease.
Does that make it more difficult to diagnose?
Yes, it can. And in a lot of very early patients with Parkinson's, it often goes misdiagnosed as depression, or that they're just having, either they're just out of shape or those type of things, especially when we're talking about balance problems or getting up and those kind of things. There are new medicines coming down the pike all the time. We've made a lot of advances in the treatment of Parkinson's with medications, also with therapies that we do to help people live a more productive, longer, happier, and healthier life.
A person who is diagnosed with Parkinson's today, are they much better off than, say, 10 or 15 years ago?
Yes, I would say so. The treatments nowadays are much better. The medications are cleaner and easier to take, less side effects. There are also other treatment options, such as Michael J. Fox. I'll use him again. He's had a surgery called a pallidotomy for his Parkinson's disease, which is another option that's available to people with certain types of Parkinson's.
Is there one medicine that's used more often than others?
Everybody that's had Parkinson's or family members is typically familiar with Sinemet, which is a dopaminergic analog, increases dopamine in the brain, which is one of the main problems with this disease process. And there are different forms of the Sinemet now. There's short-acting and long-acting Sinemet, and the neurologists are very good at combining those medications together to give a good spread of the medication to allow symptom control. There are also other medications that you combine with that help boost the effect of the medicine and so forth.
Medication can help relieve the symptoms of Parkinson's disease, but in most cases, the symptoms get worse despite the medication. When we come back, we're going to talk to Tom Shield, who's been living with Parkinson's for a little over 18 years now, and his wife Barbara about coping with the disease and treatments.
Bacon makes everything taste better. That's why the new Applewood Grill at Golden Corral features 4 new items, each with a taste of Applewood bacon. Like tender, juicy sirloin, delicious pork, plus mouth-watering chicken and our lightly seasoned salmon. Every day on the dinner buffet. It's pure Applewood bacon mastery. So come get a taste of the good life at Golden Corral.
Well, my son Hamden was 9 years old when they told us that they exhausted all of the treatments to cure his cancer. We were totally overwhelmed. Hospice anticipated our needs, a lot of times even before we knew what they were. Hospice placed my family at ease from the first day we had contact with them, as well as establishing a relationship with my son Hamden. It was because of hospice that he was able to be at home where he was comfortable, surrounded by the people that loved him and that he loved.
We are more than hospice. We are Hospice of Chattanooga.
It's easy. It's convenient. Plus, get special internet prices. Preble.com.
If you're remodeling your kitchen, you can't afford to miss this information. It's the information retailers don't want you to see.
Prior to joining Direct Buy, we'd already priced out our whole entire house of cabinetry for this project, and it was going to come to a little over $60,000. But when we went back to Direct Buy, it came back with $38,000, and that was everything included. So the savings is almost too good to be true.
Imagine paying insider prices for items like kitchen cabinets, plumbing fixtures, countertops, and appliances. There's now a way to buy virtually everything you need at prices you never imagined possible. Call the number on your screen now to receive your free insider's guide to buying direct. Plus, you'll also receive a free visitor's pass for an exclusive tour of your local Direct Buy showroom. Call right now to get started buying the Direct Buy way. Stop paying retail and become part of Direct Buy, the private members-only showroom and design center. Don't wait another minute. Pick up the phone and call now.
Welcome back. Tom Shields has been living with Parkinson's disease for a little over 18 years now. We sat down and talked with him and his wife, Barbara, about how the disease has affected them.
It is something that would make you angry, but what we did, we went into denial because I didn't think he had it and he didn't. But we realize now that he actually had it quite a while before he was actually diagnosed.
How many years before he was diagnosed?
I'd say 5 or 6 or more.
Yeah, please. And it's been how many years since?
18 and a half years.
It continues to progress, doesn't it?
Yes. Yes, it does.
There's no medication that stops it.
Not yet. They say they're working on it. But one thing that I think has helped us, we plan our days just like there's nothing wrong. And we do things, we're very active. And then if he's not feeling well or he's having a problem, then we adjust to that. But I don't sit around and think, oh, he has Parkinson's and feel down. No, we go and do, and we've gone on trips, and we just do anything that we can that we know he has it. Mm-hmm. And that's sad that's there, but you just deal with it. You just roll with the punches, and we know there's a reason, so we just keep going.
What do you say to the person who looks at you, Mr. Shield, and subconsciously or consciously thinks, poor, pitiful Mr. Shield?
No, don't feel sorry for me. Just don't feel sorry for me. I'd love to go back and redo everything over, but it can't be done. So I realized that. I don't drive a car anymore. Get to do a lot of things that I used to do, but I'm satisfied.
It's just kind of a change in lifestyle in a sense, isn't it?
Now I pastored churches for 37 years, and I can't pastor now. And that sort of hurts, but
if you give up, and Thomas Shield has this motto:
I'm not going to give up. If he knows my speeches, I'm trying to talk to somebody. I can't always do that. But I'm not going to give up.
Great attitude. Tom was also kind enough to let us follow him through some of his physical therapy. Part of the Parkinson's disease process affects the way a person walks. For instance, a man or woman with Parkinson's tends to lean forward and take small, baby steps.
What we call the festinating it. They take small steps. It's basically uncontrolled gait, and they would have a hard time stopping. I make them stop and try and see if they can take bigger steps, because I don't want to reinforce the fact that they're taking small steps. The more you help them self-correct, the longer you can delay it, a little bit, so that they can at least be independent, or they have enough movement to be functional and go on with the daily activities that they want to do. This is a knife that kind of rocks.
Next, Mr. Shield visited with an occupational therapist.
We look at all the daily activities that a person has to do from the moment you get up until you go to bed at night. So all those little tasks that you do is your occupation. Everybody always thinks jobs, but it's all those little tasks. And so a lot of the things that people have to do for self-care, feeding yourselves, dressing yourselves, going to the bathroom, taking a bath, all driving, even if we are at work, all those work activities. So we have to take into account what kind of symptoms we're having from our disability or problems, and figure out ways of being able to accomplish those tasks.
Patients have come to me and said when they first were diagnosed with Parkinson's and they were going to the internet to try to learn about this disease, they would tell me they didn't see anything on there about swallowing disorders. But here at Siskin, we've had quite a number of patients with Parkinson's who've come to us for swallowing therapy. Electrodes. Parkinson's, as you know, affects how well the muscles work together, how coordinated a person's motor performance is, as well as the strength of the muscles involved. And what you may not realize is that chewing and swallowing are actually very complicated motorically. And if anything disrupts the muscles that are used in chewing and swallowing, then it can have an adverse effect on how that person's able to eat, what they're able to eat, how much they're able to eat, can they get enough nutrition in when they are eating, is everything going the right way, going the wrong way, that kind of thing. At Siskin, for the past 3 or 4 years, we've been using, in addition to those traditional therapy techniques, we've been using electrical stimulation to facilitate a person's ability to improve strength and coordination of the muscles used for eating. Okay. When you get ready to swallow, press your lips together and then push hard with your tongue when you're ready to swallow.
For more information on physical rehab, call Siskin Hospital at 423-634-1200. As we stand behind Bob Johnson and others who suffer from Parkinson's, we hope to bring awareness to the community with public service announcements. Immediately after this interview, we're scheduled to see a public service announcement here very shortly.
Parkinson's disease is a movement disorder which affects various parts of the body.
Those with Parkinson's disease face challenges every day.
When it comes to your health, you also need support.
Everyone needs support.
News Channel 9 has teamed up
with a Parkinson's disease support group. This will help others face everyday challenges.
I'm Bob Johnson, and I know because I face those personal challenges every day. Call and get the support you need.
Indulge your cravings with new choices during Captain D's Seafood Celebration. Try our new lobster and shrimp pasta Alfredo, or our new baked tilapia with scampi sauce, or new shrimp and lobster cake dinner. You've got more choices during Captain D's Seafood Celebration.
If you're tired of being turned down and you need a little extra cash,
the ladies of National Title Pawn can help.
Se habla español. We are good people helping good people with a location near you to better serve your family.
I'm Belinda at Walnut Avenue in Dalton.
I'm Pam at Cleveland Highway in Dalton.
I'm Barbara. And I'm Michelle in Calhoun.
Come pawn your title with me. I'm Carla in Ringgold.
I'm Lori.
I'm Crystal
in Trine.
Be rational. Choose national.
At Providence Ministries thrift stores, make a deal, make a difference. New and used furniture, mattress sets, clothing, shoes, and more. Every purchase and donation helps our boys' homes, rescue missions, and alcohol and drug recovery programs. Providence Ministries thrift stores, Dalton, Fort Oglethorpe, and Calhoun, Georgia.
I just called John McMahon. They came over, took a few pictures of my car, heard my side of the story, and then no problems, no hassles, and I got a lot more than I expected.
I've been helping people in and around Chattanooga for a long time now. It's fast, it's easy, and I will get results for you.
So you've been hurt in a car wreck, and for some reason you haven't called yet. Let me just tell you, it's going to be so much easier once you call and let us take care of the hassles for you.
If you've been hurt on the job or on the road, call me. I'm John McMahon, the Insider.
Welcome back. Dealing with the progressive loss of motor skills is trying for both the patient and his or her family. Having someone to talk to that's dealing with the same situation can be very helpful. Here's information on the Parkinson Support Group.
We can lead the type of life that's going to be normal for us. It may not be the type of life that's normal for everyone, but it is for us, and we can share those steps with each other.
What I have found is so helpful when we split up in these groups. Oftentimes you'll have a problem, you think nobody else has that problem, and then if you're in the caregivers group, they'll say, well, yeah, my wife or my husband had that problem too, like not being able to sleep or shaking at certain times. They'll say, well, we had that problem. What we did was we tried this or that, and boy, did that ever help.
As a patient, I think it's not a very exciting thing to have a disease that there's no cure for, so you have a tendency to feel desperate. And I get quite a bit of help coming to this group, hearing how other people cope with their situation and their thoughts.
We've been coming to this group for almost a year now, and I think it's helped my husband and I both a lot, learning things and just being with other people that share the same things that you're going through.
When you're first diagnosed, you feel that, that you're the only person with this problem. It does help seeing other people with the same problem.
My life revolves around playing golf, bowling, enjoying life, but tomorrow I might not be able to do this. Why? Because Parkinson is going to eventually get me. And I think it puts a strain on my heart, because I got heart problems too.
By the way, if you'd like more information about their support group, you can contact Burl Lawrence at 894-8158. They meet the first Sunday in each month at 2:30 at Siskin's. Thank you. See you tomorrow.